Hey y'all, it's Rochelle, Hot Doc Shelly Smith, and today I will be unveiling some more feminine secrets. This is a huge topic. This is so important to our health. We're going to talk about how to maintain a proper vaginal pH. So, what is vaginal pH? So, every substance's chemistry falls somewhere on the pH scale between acidic and basic, which is also called alkaline. So, different parts of your body have their own pH balances, including your vagina. Your vaginal pH level matters in preventing infections, maintaining healthy pregnancies, and regulating hormonal changes. So, what is pH? The pH scale measures the acidity of a substance ranging from 0 to 14, with 0 being the most acidic, 7 being neutral, and 14 being the most basic. So, for example, battery acid has a pH of 0, water has a pH of 7, and drain cleaner has a pH of 14. So, what is the typical vaginal pH level? The vagina's pH level is about 3.8 to 4.5, which means it's more on the acidic side. Its acidity slightly decreases as you get older, with the pH level rising closer to 5. Your vaginal pH naturally fosters different types of healthy acid producing bacteria, and this helps to prevent dryness and helps to maintain a chemical balance. Your vagina also regularly produces fluid, and this fluid contains acids and it helps to prevent your vagina to be a self cleaning organism. Your vagina's acidity helps to protect against germs, it kills harmful bacteria, parasites, and fungi. So, what causes unbalanced vaginal pH? Your vaginal pH can change based on existing health conditions, lifestyle, and other factors. So, your menstrual cycle. Depending where you are in your menstrual cycle, whether you've gone through menopause, and if you're pregnant, all of this can affect your vagina's pH. Some women report vaginal yeast infections right before their cycles or right after their cycles. Medications. So, antibiotics can rise your vaginal pH because it kills all bacteria, good and bad. Birth control pills can also change vaginal pH for some people, which potentially leads to infections. So, douching. Douching is a method of cleaning inside the vagina. It involves squirting a prepackaged fluid mixture into the vagina with a tube. This process can raise your vaginal pH. Therefore, most providers recommend against douching because, once again, it cleans out the good bacteria and the bad bacteria, throwing off the vaginal pH. Now, if you're a person that has recurrent BV, and I mean recurrent BV, maybe once or twice a year, you can do this. So, this is a little nugget I'm giving you. So, say you've been treated for BV, you're doing the different methods I'm going to talk about later on, and you're still having issues. You can do a mixture of hydrogen peroxide and water and put in like a little douching bottle, okay? So, that's 1/3 of hydrogen peroxide, 2/3 of water. This is only once or twice a year if you keep having BV and you just need to kind of reset your balance, okay? So, hydrogen peroxide is more on the acidic side, okay? All right, now lubricants. Lubricants reduces vaginal dryness during sex. However, some lubricants have a pH higher than 4.5. This higher pH can kill healthy bacteria and can lead to infection. Seminal fluid, known as semen, can also make the vagina more basic. So, what are some symptoms of unbalanced vaginal pH? Your vagina pH balance might be off if you experience the following symptoms: strong fish like odor coming from the vagina, gray, green, or foamy white vaginal discharge, vaginal itching, irritation, labia swelling, pain, and burning sensation inside the vagina during sex, or burning while urinating. So these are symptoms of common infections like bacterial vaginosis, which is also known as BV, trichomonas, and yeast infections. So most of these infections fall under the larger category of vaginitis, which is inflammation and irritation of the vagina and surrounding area. So this is what you all want to know. How can I maintain my vaginal pH balance? You can take simple steps to maintain your pH balance and avoid infections by wearing the right clothing. So tight clothing can reduce airflow to your vagina and lead to vaginitis. Wear cotton underwear and looser fitting pants. If you sweat during the day or you go to work out or swim, change your clothes as soon as possible. The moisture and darkness to the area can cause swelling, itching, irritation, and most likely yeast infections. Avoid douching. You want to wash the area on the outside of the vagina with a mild soap like Dove or Dow in water, nothing else. Try to stay away from bubble baths and things like that. No internal manual washing, meaning no finger, no towel, no soap, no water inside the vagina. It's on the external only. This is very important. This is a key point. No internal vaginal washings, okay? This can reduce the level of BV dramatically. You want to use condoms during sex because, like the vagina, the penis has its own bacteria, and unprotected sex can lead to infections if the bacteria can come in contact with the vagina. So using condoms can keep bacteria and germs away from the vagina, and it can keep seminal fluid from entering inside the vagina. Change your diet. So many types of yogurts are rich in the same bacteria that lives in your vagina. And this bacteria is called lactobacillus. We'll talk about this again. Avoiding sugary processed foods like white bread and rice can help prevent yeast infections. I often recommend in clinic the use of probiotics. So probiotics kind of helps to maintain a vaginal pH because it also has that lactobacillus species inside of that. So you can take it once a day by mouth like a vitamin. I usually tell my patients to look on the bottle and make sure it either has vaginal health or women's health on the bottle because some probiotics are for the gut, the stomach. So you just want to make sure it's geared to the vaginal pH maintenance. Boric acid vaginal suppositories is something else I recommend. With this, you can, if you're having a case of discharge or smelling odor, you can insert one nightly or twice a day for 7 to 14 days. Then to maintain, you can insert one nightly for 5 to 7 nights after your menstrual cycle. Insert one nightly for 2 to 3 nights after sex to maintain a vaginal pH. So this goes inside the vagina, okay? I will post a link so that you can get to some products that I often recommend in practice. I do have an affiliation with Amazon, so you can just click the link and get your product shipped right to your house. So, what to do next for an unbalanced vaginal pH? So, unbalanced vaginal pH can lead to more serious illness. Untreated vaginitis raises your risk for pelvic inflammatory disease, infertility, and increase your risk for contracting sexually transmitted diseases. So if you're experiencing symptoms, you definitely want to contact your women's healthcare provider. They will ask you about your medical history, your symptoms, and examine your vagina. They will also perform a vaginal swab, and they can test for BV, test for yeast, and also screen you for STIs like chlamydia, gonorrhea, and trichomonas. They can prescribe antibiotics and other treatments to ease your symptoms based on the physical exam and symptoms you express. So when prescribed medications, it's important to take and complete the prescribed medication. So although if you feel better, you still want to complete the full dose because if not, those bacteria become superbugs, we call them. They will get bigger and badder and harder to cure. So this is a lot of information, and this is something that is so important because a lot of the cases I see throughout the day is vaginal discharge, vaginal odor. So take these recommendations. If you need to listen to it over, if you need to write notes, definitely spread this information because this is evidence-based information with your friends, with your family members, with your coworkers. Guide them to this group so they can get this information as well. So this is something that is so common. So I want you guys to be free and comfortable and not embarrassed to talk to your providers about this. Definitely get what you need and the resources that you need to kind of make sure you maintain your vaginal pH and keep yourself healthy. So y'all have a good night. Y'all be blessed. Peace.